Good afternoon, everyone, and thank you for joining us here today. Last Friday, I had announced several measures our government is taking to begin to address the pressure that the Saskatchewan health care system is currently experiencing. And we continue to see that pressure increase on our system as Saskatchewan now does face the fourth wave of the COVID-19 pandemic. Since Friday, we have experienced record case counts, and our hospitalizations have risen to near record loads. Now we are at 218 residents in hospital, 48 of those in our intensive care units. These hospitalization metrics are not far from where we peaked in previous waves of the COVID-19 pandemic. And in the weeks ahead, we could very well exceed those previous peaks experienced during those previous waves that we had experienced, placing tremendous pressure on our healthcare system. But unlike previous waves, this wave of the pandemic is being driven almost entirely by one group, the unvaccinated. Over the past few weeks, we have released daily data that clearly demonstrates just this fact. New cases are overwhelmingly in unvaccinated people. Hospitalizations are also overwhelmingly in those that are not vaccinated. Our hope was that by presenting this clear evidence, that those that had chosen to this point to be unvaccinated would make the right choice, and they would go out and get vaccinated. Some did, by all means, and some are yet today. But many have not yet, and we have been very patient. The government of Saskatchewan has been very patient. Possibly we have been too patient, and that time for patience is now over. The choice to not get vaccinated is not just affecting you. It is now seriously impacting those that had made a different choice. It is affecting their ability, in many cases, to go to school and enjoy every day of life. It's impacting those that are not yet eligible for a vaccine. It's affecting people's ability to get access to medical services and to surgeries. And it's prolonging this pandemic for everyone. The choice to not get vaccinated is creating consequences, yes, for others, and now it unfortunately is going to create consequences for you. Today our government is announcing a proof of vaccination or negative test requirement, along with the introduction of an interim mandatory masking requirement. Effective Friday, September the 17th, that would be tomorrow, an interim public health order will be in effect requiring the use of non-medical masks in all indoor public spaces in Saskatchewan. The order is targeted to be lifted in late October, at which time a full proof of vaccination or negative test requirement will have been implemented for about 3 to 4 weeks since October the 1st, when it will be implemented. This order will not apply, the masking order will not apply to youth athletics for those under the age of 18 while they are actively engaged in that athletic activity. But it will apply for entry and exit to those venues that are hosting youth athletics, as well as to spectators who may be watching. As I stated, Saskatchewan will also be introducing a proof of vaccination or a proof of negative test requirement. And that starts with employees of your provincial government. Effective October the 1st, a proof of vaccination or negative test requirement will be implemented for all Government of Saskatchewan ministry, Crown, and agency employees. Employees of all Government of Saskatchewan ministries, our Crown utilities, and our agencies will be required to be fully vaccinated with the COVID-19 vaccine by October the 1st. Employees that do not provide that proof of vaccination will be required to provide a proof of a negative test result on a consistent basis, and the full details of that will be communicated to these employees in the coming days. The Government of Saskatchewan is also encouraging other employers across the province, including our school divisions, to implement a similar proof of vaccination or negative test policy for employees in their workplaces. Having your workforce fully vaccinated is one of the best things that you can do to protect yourself, to protect your customers, and to keep your doors open. Also effective on October the 1st, Saskatchewan will be introducing a provincial requirement for proof of vaccination or negative test for public access to a list of establishments, businesses, and venues. Specifically, this will include venues that bring groups of people together in public spaces, including indoor dining at restaurants, nightclubs, bars, taverns, events like entertainment venues such as conference centers, casinos, movie theaters, concert venues, live music venues, museums, and facilities that host ticketed sporting events. As well, we will include indoor fitness centers and gyms. Proof of vaccination will not be required for several publicly accessible places, such as retail businesses, including our grocery stores, places of worship, fast food restaurants that offer takeout and delivery, healthcare services that people would require, professional services that people also require, as well as personal services. And it will not apply, the proof of vaccination policy will not apply to facilities that are hosting non-ticketed amateur sports, including youth athletics, as well as recreational leagues. Also on the list of not requiring a proof of vaccination will be hotels and other lodging environments, places of businesses or business meetings that are closed to the general public, unless where the employer may so require. This requirement will also not apply to private gatherings that are held in public indoor venues, and examples of that would be weddings or funerals. For the past several weeks, work has been underway on Saskatchewan's Verifiable Vaccination Record, or our QR code, which will be launched the week of September the 20th. Details including the instructional materials on how to download and utilize this platform will be shared by the Ministry of Health prior to the launch of this verifiable vaccination record, or otherwise known as a QR code. And while we encourage all Saskatchewan residents to download this easy-to-use verifiable code, other allowable proof of vaccinations will also include the following: the card that was given to you or to individuals when you received your vaccine that was handwritten with the vaccines on it, along with a printed or a screenshot of your eHealth's MySask vaccination record. For residents who choose not to get vaccinated, it won't be as convenient as flashing a QR code, because you will not have one to access these services and activities. The protocols that will be in place regarding the proof of negative test requirements are currently under development, and for those residents opting to provide that proof of a negative COVID-19 test, we'll have information in the next number of days on what exactly that will look like. This will include the required provision of documentation demonstrating proof of a negative COVID-19 PCR or rapid antigen test that will be provided by a certified healthcare provider, including private providers of the COVID-19 tests. Today we're also announcing that the Government of Saskatchewan will be working immediately to expand widespread access to rapid antigen tests for home-based self-administration screening, to expand our testing capacity in the province. Widespread access to these tests will provide residents with screening tools, as Saskatchewan is experiencing increased rates of COVID-19. The idea that any resident or family will be able to easily obtain these rapid tests for personal use, this is the goal, that is that families will be able to easily obtain these rapid tests for personal use so that they can screen themselves and their loved ones or family members for COVID-19. The Ministry of Sask Builds and Procurement, alongside the Ministry of Health, is working on a plan to distribute these to several locations throughout the province with our partner agencies. And these locations as well will be published in the coming days. It's also important for us to note that the recommendation to seek PCR testing through the Saskatchewan Health Authority and the stay at home at the first sign of any symptoms effort will continue. If you have any symptoms, you should stay at home, and you most certainly should go out and get tested. I'll end today on a rather blunt note. For the past several months, our government has been among the most patient in terms of providing our residents with the opportunity and the access to vaccines, thereby providing that opportunity to do the right thing, to go out and get vaccinated. We've made vaccines available at mass vaccination clinics. We've made them available at pharmacies. We've made vaccines available at pop-up clinics where people live, work, and play throughout the province. In the early days and throughout, we designated 14% of our total tests and our total vaccines to Indigenous services and to our northern communities in our rural and remote and northern locations across Saskatchewan. We've even gone door to door in some of our northern communities offering testing and offering vaccines in numerous communities to those households that may not be vaccinated. We have remained patient as a government, and we have exhausted all of these avenues because we know how effective vaccines can be when people choose to take one. But today that patience has come to an end. If you are unvaccinated and living in Saskatchewan, it's now time to get your shot. The vast majority of Saskatchewan people that have done the right thing, quite frankly, they are tired of those that have chose not to. And that is what is now driving the fourth wave in this province. And our province is not going to wait for you as we continue to move forward. Thank you. Dr. Shahab, do you have any additional comments?
Thank you, Premier. I'll first of all start with some data and then some opening remarks. So if we look at our vaccination rates, as the Premier said, overall first dose 78%, 69% in youth 12 to 17, 70% in young adults, and then goes up to 77% 40 to 49, 80% 50 to 59, 82%, 89% 60 to 69, 91% 70 to 79, 80%, 94% 80 plus. Second dose, however, 70% overall. So there's an 8% gap even in second doses, and this is the time to get the second dose for those who haven't. And this gap is through all age groups. So, for example, 12 to 17, 69% first dose, 57% second dose, 8% gap. 18 to 29, 70% first dose, 56% second dose, 14% gap. So people really need to step up and get their second dose, get the full protection to stop transmission. And then for young people, the 30% who haven't stepped up, please come forward. Similarly, even though, for example, 60 and older, 89% first dose, 84% second dose, in people who are 60 and older, especially 70 and older, the 10-15% who are not vaccinated are resulting in hospitalizations in ICU. So if you look at our hospitalizations, we can see that hospitalizations in unvaccinated are occurring in every age group. 1 person in under 11, 2 in 12 to 19, 6 in 20 to 29, 12 in 30 to 39, 15 in 40 to 49. So hospitalized unvaccinated still increasing by age group. 21 50 to 59, 27 60 to 69, 27 70 to 79, and 18 80 plus. So these are in the unvaccinated. So 10-15% of people above 70 are still causing high hospitalizations and unfortunately death. So I have to stress that if you're unvaccinated, please step forward. Delta is twice as transmittable, twice as severe, is causing hospitalizations on the unvaccinated like never before. And then for breakthrough infections, I would stress people who are fully vaccinated may get mild illness occasionally, but and that's why we all have to wear masks. But we are seeing in people 70 and older, the 90% who are vaccinated are generating some breakthrough infections, much less than the 10% who are unvaccinated, but we are seeing 12 people in hospital, 70 to 79 fully vaccinated, so less than the people who are unvaccinated. So 10% unvaccinated are generating twice the hospitalizations than the 90% who are vaccinated, but we are seeing hospitalizations in 70 to 79 and 80 plus, and that is because many of these individuals unfortunately have other comorbidities, immune suppression, and so while additional doses are being given, we have to make sure that people who are at higher risk because of immune suppression still shield themselves from people who are unvaccinated, and when local transmission is high, as it is now in Saskatchewan, everywhere, and they shield themselves at all times to prevent breakthrough illness. And this brings me to my second point on the data, that when we look at our case rates, what is different today is that all parts of Saskatchewan are above 10 per 100,000. Even Regina has tipped over into more than 10 cases per 100,000. Our provincial rate, generated by the 30% who are unvaccinated for the most part, is at 36 per 100,000. And our test positivity is at 11%, and of course much higher in the far north and Saskatoon. So again, our indicators, both for hospitalization and case numbers, are concerning. Now coming to the announcements today, as the Premier said, these measures start immediately. The masking starts immediately from midnight. And while it takes 4 to 6 weeks to see an impact in hospitalizations, wearing a mask stops transmission immediately. And that will have an impact on cases presenting 4 or 5 days later. In addition to that, we've all done this before. Rethink our gatherings, especially if you're unvaccinated. I think this is not the time to go to that birthday party, to go to that family gathering. You know, protect others and protect yourselves by getting vaccinated and being very cautious by going to any gathering, even if you're wearing a mask, if you're unvaccinated. I think we really need to think through that right now. And then we will obviously have to monitor how the vaccine rates come up over the next 4 to 6 weeks while the mask order is in impact, and how not just by wearing a mask, but by practicing everything else we used to do: physical distancing, mask use, hand hygiene, staying home if you're ill, getting tested. You know, we'll have to see how on a weekly basis are our case numbers coming down while our testing rates remain up, and then after 2 to 4 weeks, are our hospitalization coming down. If the trend starts coming down, which our information suggests that if we follow these measures, it will, then that's great. But if it's not trending down, unfortunately, as we've said before, other measures, unfortunately, will have to be on the table. The other thing I'd like to say is that schools have started. When we started schools in 2020, there was no vaccination. But at the end of the summer of 2020, our case number was very low. Schools started in a very safe manner, and we had a reasonable school year. In fact, it was quite good in the fall. We had some challenges in our second and third waves, the third wave mostly in Regina. But, teachers, parents, children, we all pulled together and had a safe school year. This year around, school has started at a time when case rates are high. And we know that children 11 and under can't be vaccinated. But it is astounding to see that 98% of children who test positive are in households who are unvaccinated, about 330 cases so far. So again, it stresses that the best thing we can go do to have a safe school year is to make sure everyone in the household 12 and over is fully vaccinated starting today. And I think that will enable our children who have had to suffer so much last year, with disruptions in school, with not being able to play, that by having everyone in the household vaccinated, children can go to school, children can play sports, things that they could not do last year. And finally, I'd like to say that, we did not face this situation before because we had public health orders throughout the last 16 months till July that limited our ability to go to restaurants, to see each other, to engage in gatherings. Our numbers came down, starting in June, much more than we would have predicted, and we had a great summer. We had a great outdoors, mask-free summer. As our case numbers come up, for all the reasons I mentioned, we have to mask up, physical distance, practice all the behaviors we know so well. We have to make sure all of us get immunized with 2 doses. There's less than 0.1% of the population who may have an allergy or to a vaccine component, less than 0.01%. I've heard of a handful of cases, I can count them on my fingers, who have had any contraindication to a vaccine, a true contraindication. So while we hope our vaccination rates will go well above 80%, there's no reason why they shouldn't go much higher. And that is what will guide us to a better winter. But otherwise, unfortunately, we'll keep seeing pressure on our acute care system, And right now, as has been presented by Mr. Livingstone and others, we are reaching a phase where if things continue unabated, people who have COVID won't have an ICU bed. People who don't have COVID but have a heart attack won't have an ICU bed. And of course, people who are waiting for urgent surgery will keep getting delayed. So I think things are at a critical juncture, but the solutions are pretty simple. Get vaccinated if you haven't, get your second dose if you didn't get around to getting it, and wear a mask and practice all the other measures we've been doing for in the past. Thank you very much.
Premier Moe and Dr. Shahab, we'll get into questions in the room here. Just as a reminder, please unmute yourself so that Dr. Shahab and Mr. Livingstone can hear you in Regina. And we'll start with Sask.
Premier, over the past month, you and your health minister have repeatedly rejected the exact measures that you are introducing today. That's despite a letter from all the medical health officers of the province recommending some of these measures that was actually drafted in late August, as well as a follow-up letter from the leaders of the Saskatchewan Health Authority's pandemic response in support of that statement from the inmate host. So my question to you is as follows. Do you take any responsibility for the state that we are in here in Saskatchewan? Were you wrong? And does your government still have credibility on COVID-19?
Well, listen, with respect to the decisions that have been made here today and the decisions that have been made throughout this pandemic, we've been clear from day one. The decisions that we will make are made to protect the healthcare capacity that we're offering in Saskatchewan. That is not only the healthcare capacity that we have available to offer to those that may have COVID and need care, but the healthcare capacity for all of those that would otherwise need healthcare for various other things, and quite honestly, the access that people ultimately expect. With respect to the decisions that are being made here today, there are many opinions with respect to these decisions that have gone too far. These decisions have not gone far enough. These decisions are being made too soon. These decisions are being made too late. And I'm certain, and I know that we have heard various opinions in the lead up to today. We'll likely hear various opinions in the days ahead of people across the province. But the fact of the matter is we are always making decisions collaboratively with Dr. Shahab, with our Saskatchewan Health Authority, with the government of Saskatchewan. We're making those decisions with the information that we have at that point in time, and we're making those decisions in the best interest of ensuring that we can preserve the capacity of the healthcare system. We've been clear about that from the very early days of this pandemic.
Were you wrong, though, sir? Do you take responsibility for that?
Some will say that the government has made poor decisions all throughout this. Some will say the government has went too far. Some will say the government has not gone far enough. No, with respect to the decisions that we're making here today and the decisions that we have made throughout this pandemic, what I would say is that this government has attempted to make the very best decisions that we can collaboratively with these two gentlemen on the screen here, Dr. Shahab, Scott Livingstone, as well as others. In the best interest of the people of the province, with the information that we have available to us at that point in time.
Can you acknowledge that you were wrong? Were you wrong?
I've just told you that with all of the decisions that we've made throughout this pandemic, some will view them as not being the correct decisions. Some will view them as being the correct decisions.
What you think, sir.
Hey,
I'm asking you.
Listen, the decisions that we've made here today, I believe, are the best decisions for this point in time.
So I might ask a follow-up. Dr. Shahab and also the Premier. Dr. Shahab, their counterpart in Alberta, Dr. Regina, was very candid recently that it was a mistake to reopen as fast as the province did in July, and that it sent the signal that COVID-19 was over and no longer a threat. We also opened in July. I believe we called it a great Saskatchewan summer was the term used at that point. And in fact, I think we fully reopened before we had hit the threshold that we set in terms of vaccinations to reopen by a margin of 2 days. Did we reopen too fast? Was that a mistake as well? And Dr. Shahab, do you think that it sent a message that COVID-19 was over in the province?
Just before we start with that, Dr. Shahab, I think I'd explicitly said at that July 11th, in that press conference leading up to July 11th, that this is not a mission accomplished, that we are still living with COVID as we look out to the months and the weeks and months ahead. By no means did this government put forward that COVID was over. I had specifically said in those notes at that point in time that this is not mission accomplished. There is still work for us to do, but we do have the opportunity, and I think we have had the opportunity to have a great summer, largely outdoors. But Dr. Shahab, you'll have some additional comments, I'm sure.
Yeah, thank you. So I'll maybe speak to the data at that time, some of the projections, and then the challenges with Delta. So, I think all of us over March, April, up till March were really happy that the 2-dose vaccine was so effective in protecting the most vulnerable long-term care. So when we had a third wave, only in Regina mostly, and then some parts of the south, we did not see hospitalization death in the most vulnerable who were already vaccinated by March, April. Secondly, as our vaccinations picked up and we were leading the country in vaccination by age group over April, May, June, we saw case numbers decline by much more than what we had expected. And that was really good news. The challenge, of course, was that, and obviously all of us wanted to go back to doing things we enjoy safely, and vaccine provided that safety. And there was many things we enjoyed over the summer with low case numbers. But I think the challenge was, there were two challenges. One, our vaccine uptake stalled, and we can debate the reasons for that. Some people getting complacent that maybe they live in a rural area, they're young, they're healthy, they don't need to get vaccinated because everyone else is. There's lots of reasons, but our vaccine uptake stalled. And it was no longer, the SHA, our partners went out of the way to provide clinics to address complacency and access, convenience. So it is no longer an issue of that. It was just that, people thought, well, now I don't need to do my bit. And the other thing was Delta. The predictive modeling was saying that you can start reopening with 75% first dose, 20% second dose. Our first dose is not that high. Our second doses, when you start reopening, were much higher, and then that you would be safe at 75% 2 doses. We are still not there yet, but the Delta variant has shown that it is twice as transmittable. So instead of infecting 2 people, 1 person who's infectious infects 4. And it is twice as severe. Instead of 100 people in hospital, we have 200 at the same rate of transmission. Even though most of the transmission, as I said, is in younger populations, it is twice as severe. And the bulk of the hospitalizations are in unvaccinated people who are at high risk, 60 and older, who still remain unvaccinated. So all these factors have led us to where we are today. And of course, I think while, public health is always cautious in terms of preventive measures, at a societal level, at a government level, you have to balance being able to stay open, enjoy the things we enjoyed over the summer. But when things start trending at a rate that's alarming, which is where we are today, proportionate measures have to be taken. And again, right now, those measures are consistent mask use and all the other things we have to practice. That's by a public health order, the proof of vaccination requirement coming in within 4 weeks, so that anyone who wants to access those indoor locations will have to get vaccinated. But then we also need to think on a discretionary basis about everything we are doing right now. Is that gathering at someone's house essential? How can we make it safer? The weather is still nice. Can we have it outdoors? Is everyone fully vaccinated? Those things are discretionary measures right now. But if our trends don't, trend in a plateauing and downward factor, unfortunately, other measures would still be required. We hope they are not, and we all pull together. But if that doesn't happen, unfortunately, other measures will be required.
So again, though, just going forward, we have to get the hindsight on this. Was it a mistake to reopen the province at that time? Does anyone take responsibility for it? It can be a yes or no response.
I think at that time, the recommendations were that you can safely reopen and enjoy a summer, but there were always these cautions that, and I think I always said, and the Premier said, that when you're in an indoor crowded location, keep a mask with you, put it on. I think many of us stopped practicing many of those measures. We all know that in indoor crowd locations where masks should be worn, whether you're at a Riders game, in the washrooms or food concession areas, those are all locations where a mask should always be worn, but there was no order. People stopped wearing a mask. There's even this sense of complacency that maybe masks are not required. So, yeah, I mean, I think one mistake is that one hoped that, behaviors that we had learned over 16 months would continue, but they got dropped very quickly. And now you're back to an order for mandatory mask use because it's no longer up to just individual behavior. We need an order for mask use and all the other measures to practice physical distancing. Things like private gatherings are still discretionary, but we need to use common sense. And if that is not enough, then unfortunately further orders may be required. So I think we have to be proportionate. Like all of us enjoyed summer meeting with friends and family, mostly outdoors, sometimes indoors without a mask. We all enjoyed that summer, and it was safe to do so, but now it is not.
I would just add to that. What you're attempting to do, Zach, is to compare two different points in time when the information that's available at those two different points of time is very, very different. A point in time in early summer where we have the summer ahead of us, school is not in for that period of time. School is now in during this period of time. Our Delta rates are very different earlier in the summer than they are today. Our vaccination rate, as Dr. Shahab had mentioned, was going along quite ambitiously, has stalled over the summer throughout into the fall here. And what you're seeing here today is our decisions that are being made with the information that we ultimately have available to us today, understanding that our hospitalizations are up. And you saw some announcements last Friday to ensure that our hospitals... Could you turn your microphone off, Dr. Shahab? Would you turn your microphone off, please? Our hospitals are supported with the decisions, and they're very significant decisions, up to and including the emergency order that was reenacted to ensure that we could provide those resources. You're also seeing now today decisions coming in that are greatly going to incentivize those that are choosing to be unvaccinated in the province of Saskatchewan to reassess their decision, and ultimately it's our hope that they will go out and get vaccinated to protect not only themselves, but as Dr. Shahab says, those around them. Most importantly, those that cannot be vaccinated, such as our children. And so, what you are seeing today with the announcements that are being made, and even if we extend back to last Friday, are decisions that are being made with the information that is available here and today.
We'll take our next question from Emily.
Thanks, Amy. I just wanted to clarify some of the new restrictions in terms of proof of vaccine or a negative test. You mentioned that there is no applicable need for youth sports, but it does apply for entry and exit to venues and spectators. You also mentioned that there is a requirement for proof of vaccine or negative test at sports events that are indoors. But then you followed up by saying that amateur non-ticketed sports do not require proof of vaccine or negative test. Can I just clarify what you meant by non-ticketed amateur sports when sports events are required to have it and youth sports are not?
So what we're doing, and this is somewhat associated to the public health order that we have with respect to masking as well. I'll start with masking and then I'll come to proof of vaccination. The masking order that we have in place will apply to all indoor public places. But we do have an exemption for those 18 and under that are actively participating in youth athletics. For example, hockey, soccer, lacrosse, some of those youth athletics. Our youth have been greatly impacted over the course of the last now 20 months, and we want to, if we can, keep things as normal and as close to normal as possible. And so we have made an exemption with respect to under 18 youth athletics for the participants. When they're entering and exiting the recreational facility, or those that are coming in to be spectators in the recreational facility, we would ask that they do wear a mask. With respect to proof of vaccination, we are there is an exemption for those amateur sporting facilities that would, for example, minor sporting leagues that would be operating in communities and cities across the province. However, the larger events that are coming together that often are ticketed, and that's where the discretion is, the ticketed events, such as, for example, our junior hockey leagues in the province would then be covered under the proof of vaccination policy in a similar fashion to, albeit an outdoor venue at Mosaic in Regina. The Saskatchewan Roughriders are implementing that policy as well at their next home game. And so that is the difference, is the minor sports organizations that we have. We want to ensure that they can continue as much as possible to operate in a normal manner. We don't want to disincentivize our youth in participating and participating in athletic activities. However, when we get to the ticketed leagues, which often will have larger number of spectators, larger number of people coming together, we would ask that they ultimately do institute the proof of vaccination, the records, and we're going to provide, as we said, not only the QR codes to individuals who can then produce those if they choose, but the scanning devices as well for those organizations to make it as seamless as possible.
Dr. Shahab, did you want to add to that?
Yes, thank you. As I said last week, the hardest thing was for young people to give up last fall sports, many extracurricular activities, because there was no vaccination, and they had to bear a disproportionate burden to protect people who are older and at higher risk. Now we have safe and effective vaccines. At the same time, I would encourage all people 12 and older to get vaccinated. It is surprising to meet young people who work frontline in restaurants and retail who are fully vaccinated, but they say their parents or grandparents are not, because they've seen something on social media or someone has told them something. I found that astounding for a country that's highly developed, science-based, technologically advanced. I find such attitudes surprising, and I think anyone who is deep into misinformation needs to course correct themselves or be helped by friends and families and their children to course correct. Secondly, I mentioned earlier that children 11 and 12 and older, everyone should be vaccinated. There's hardly any contraindication to vaccinations, less than 0.1%, and that will keep everyone playing sports in school safe. And as we look to the future, our vaccination rates for everything else, all the other life-threatening diseases that we don't see anymore, polio, mumps, measles, are well over 90%, 95%. And again, it's a sign of the times that our vaccination rate overall is still 70%. But when vaccines are approved for children, 5 to 11 and later in the fall, and for children younger than 4, one would expect to see more than 90% uptake. And I would just question all of us that why, with the worst pandemic we've seen in 100 years, vaccine uptake is so low. Many other parts of the world are still waiting for their vaccines. They are pleading, don't give boosters, give us first doses, second doses to our elderly, our healthcare workers. And here we have a third of the population mired in conspiracy theories.
Yes, if I could just ask a follow-up. So my understanding is that a lot of this is to protect people who cannot get vaccinated, and that especially includes children, as you mentioned. So I'm a little bit confused as to why vaccine requirements would not apply to a location where children are running around unmasked so close to one another, when that's an age group that we are looking to protect and to push vaccination to protect as well.
So Dr. Shahab, you may have some to add to this as well. But part of the reasoning behind this discussion was, yes, to keep things as normal as possible, and allow our children the opportunity to compete and to get out and participate in whatever recreational athletic opportunities they have. Ultimately, at the end of the day, the best way, and you're right, to protect those that can't be vaccinated, namely our children, as well as those that are elderly in our community, is for as many of us around them to ultimately be vaccinated. And that is why we put in a number of initiatives, and probably some of the most significant initiatives that this province has ever seen in its history with respect to the public health measures and the very strong encouragement that is in place with these measures to encourage the uptake of vaccinations, up to and including, and we will see the participation from employers across the province, but it's our strong recommendation that they follow the government's lead with their employer-employee relationship. So this is not an initiative that is included at this point in time. That being said, I would go back to Dr. Shahab's point of in schools, and we'll use schools as an example. We have had last year, and even this year, we do have positive COVID cases coming into our school. Dr. Shahab said it predominantly. Those positive cases in those youth are in households that are predominantly unvaccinated. So the best way for us to protect them is for all of us to ultimately get vaccinated. We have not seen, not without it, but we have not seen large-scale transmission of COVID-19 in most cases throughout the schools in Saskatchewan, and we're expecting that we will have similar results with respect to allowing the kids to recreate and allowing the kids to go out and participate in the recreation opportunities that they have. Dr. Shahab, do you have anything to add to that?
Thank you, Premier. Apologies, I may not have heard the full question and the response, but from what I could gather, like I said earlier, youth have given up a lot. I think while they're playing contact and non-contact sports or exerting in physical activity, they can choose to be without a mask. Obviously, when they're congregating and if they're too young to be vaccinated or otherwise, if they're congregating in indoor space, they are expected to wear a mask. In the locker room or other settings. But we are in a different time compared to October, November last year. We do want children to have a more normal life, including school, sports, other extracurricular activities, but also to be vaccinated once they are of age, which is, turning 12 this year and older. And like the Premier said, children 11 and under are not independently mobile. They are protected by fully vaccinated older siblings, family, parents, households. That's their protection. If they're playing on a team, you would expect all the coaches to be vaccinated. In schools, you would expect 99% vaccination rate of school staff. Daycares, you would expect 99% vaccination rate of after-school program staff and daycare staff.
We'll take our next question from Devin.
All right, so yesterday in Alberta, Premier Kenney said that without any restrictions imposed, that they would likely probably potentially run up ICU beds and staff within 10 days. Where does that kind of sit here in Saskatchewan with that?
Well, I'll start. Scott Livingstone, you'll have something to add, I'm sure. As the discussions have intensified over the course of the last number of days. We saw the announcement that we had come out with last Friday that was to specifically support our ICU staff specifically, but also all of our healthcare staff that are offering services, and to expand the ICU capacity that we have here in the province. The second part of those discussions that we have been having started on Friday with some of the public health measures that we'd introduced, but are really coming to fruition today with the larger suite of public health measures that are coming into play, namely interim mandatory masking in public indoor spaces, and secondly, introducing a proof of vaccination policy for government employees, and also a proof of vaccination, proof of negative test policy for a number of patrons that will be visiting various businesses across the province. And so very, very significant measures to ensure that we're providing the supports for our healthcare system and to the people that are working in our healthcare system, freeing up some of the mobility of our healthcare staff last week, and B, introducing a suite of public health measures. And I would say we do this reluctantly, but we do this to ensure that we can preserve the capacity of that healthcare system in the weeks and in the months ahead. Scott, you might want to speak to a little more specifics with respect to the pressures that the healthcare system is feeling and may feel for some period of time now.
Thanks, Premier. So as we discussed last Friday in the news conference, there was a series of slowdowns that were being not just contemplated but actioned on Monday with the signing of the new letter of understanding with our union partners. On Friday, we talked about us building capacity to have 255 acute care beds for COVID patients across the province and 80 ICU beds. We are, as you've seen with the case numbers since Friday, and our average daily cases going up dramatically. Just by looking at what's happened over the last 10 days, we are actively looking at other major slowdowns to help again increase both our inpatient beds and ICU capacity across the province. Right now, over the next few weeks, we are concerned about the volume of cases that will come in. As we talked about again last Friday, it's important for folks to remember the cases we see today coming into hospitals and ICU are from people who were infected 2 weeks ago. So there's very little we can do today to stop that from happening other than building capacity, supporting our staff, and using tools like slowdowns. And again, as I said last week, these slowdowns will affect every single resident of this province. The SHA being a provincial organization, we will do load leveling and use all resources available to us to care for both COVID and non-COVID patients during this time. But we will be tested as an organization like we have never been tested before over the upcoming weeks.
We were talking about last week the service slowdown. Which specific services are slowing down in hospitals at the moment to take care of this surge in COVID-19 cases?
Scott?
So over 156 services across the province have already been slowed down or in the process of slowing down to free up highly trained and skilled resources to support inpatient care and ICU. We will be bringing forward a number of other slowdown options in the days to come because we already know that we do not have enough inpatient capacity built today to accommodate the cases that we are going to see. I can follow up with media services to provide you a listing of the 156 services that have already been approved for slowdown and that we are in the process of or have already done slowdowns with. And this would be similar to the work that we've done before, both through the first phase of the pandemic, but also during other ways where we've had to slow down services to support our COVID response.
Are we looking at triaging in ICUs at the moment? And if not, are we looking at forward in the coming weeks?
So it's a good question. As you know, we do have triage protocols for critical care. I would say that to remind folks, and the Premier has said this, and Dr. Shahab has already said this, is that when we're building capacity for COVID and taking services down, that affects everyone who requires healthcare services. So although I would say we haven't formally entered into a phase where we're using the triage protocol, each and every single day we are making decisions at the cold face with clinicians on whether or not surgeries go forward because we don't have available ICU beds for patients to care for them. That's the risk of having a pandemic with unvaccinated individuals that are consuming resources because they require care. They are sick individuals, but that is already reducing our ability to care for individuals across this province.
If I could just do one quick follow-up on that, is there a possibility of reopening field hospitals to deal with the number of cases coming up?
The field hospitals have been decommissioned, so the answer to that question is no. We have had many discussions through our EOC together with our partners at the Ministry of Health. And right now, even looking over the next few weeks, to be honest, it's not equipment or beds that's our concern. It's actually skilled staff to care for those patients. And it's why we will be looking at all provincial resources across the SHA to care.
You'll remember the discussions we had these nationally at our Council of Federation table and First Minister's table with respect to ventilators and some of the critical care equipment and the inventory that all provinces had and collectively we had across the nation. And we do have, from what I'm being informed, the sufficient inventory of supplies. It is about people, which is why you have seen the announcements late last week with respect to reallocating our healthcare staff, and it's why you're seeing the announcements this week so that we're able to actually bend the curve of the number of people that are entering our hospital over the course of the next number of weeks and months so that we can preserve that capacity ultimately for all.
We'll take our next question from Paris Wall.
For the Premier, yesterday Jason Kenney apologized for his handling of the pandemic and moving too quickly to an endemic. Will you, Premier Moe, apologize to Saskatchewan people for the way you've handled the fourth wave and waited until now to reintroduce restrictions?
Well, as I said before, we're continuing to make decisions with the information that we have. We discussed earlier how the decisions that we're making today are different than the decisions we made in the springtime, in June into the early days of July. The conditions that we're faced with here today are different. And I would say that we do have a tool here today that we haven't had throughout this pandemic that has proven to be very effective, and that is wide-scale access to vaccines. I believe there's about 450,000 vaccines that are sitting in vials today in the province of Saskatchewan, in virtually every community across Saskatchewan, and they're waiting for someone to come in and volunteer to take one of those vaccines, and in doing so, keeping themselves safe and keeping them around them safe. So throughout this pandemic, this government has been clear. We make the decisions that we make with the information that we have at that point in time, and we make them to ensure that we're preserving the healthcare capacity that we have, the healthcare capacity that ultimately the people of this province expect us to be providing.
Yeah, what's your reaction to calls for the health minister to resign?
Well, the health minister has not offered his resignation, nor would it be accepted. The health minister has been working very diligently with Dr. Shahab, with Scott Livingstone, with Max Hendricks throughout the Ministry of Health, as well as our partners, healthcare delivery partners across the province, day, night, weekends. The health minister, as well as keeping myself informed, is doing exactly the same as I presume what health ministers are doing across the nation. He has information that is before him today, and as weeks go by, that information does change. But he's making the very best recommendations to the government and to others that he can with the information that is before him. And so, the effort of this health minister and previous health ministers throughout this pandemic is an effort that I have been proud of, and it's an effort that I fully support.
We'll take our next question from Laura.
Mr. Kenney, you said last week, quote, creating two classes of citizens based on your vaccination status is very difficult and it's a very divisive path for the government to take. In Saskatchewan, it will remain a choice. Premier Jason Kenney said that in Alberta yesterday, and he changed his path yesterday. So are you announcing these measures today because Alberta also announced changes yesterday?
Well, let me first reference a statement. That is a correct statement. It is a difficult and divisive path to take. Whether or not you are vaccinated in Saskatchewan today, tomorrow, or in the future is your choice. I have also said, and I've been very clear, that as we move forward in Saskatchewan, if you choose not to be vaccinated, life is going to become more difficult. And I think with the measures that we're introducing here today, that statement also holds to be true. With respect to how we came to the decisions that we have come to today, and I'll probably tie in the decisions that we came to last Friday, which are really part of a suite of decisions supporting our healthcare capacity and putting in a significant public health measures to bend the hospitalization out into the future. These are discussions that are ongoing between Dr. Shahab, our Minister of Health, myself at times, Scott Livingstone, the Ministry of Health, and other partners as they needed. Sask Builds and Procurement has been part of this with procuring some testing capacity as well as some other services. They're ongoing. I would say they really began to intensify 7, maybe 10 days ago around that very focused conversation of the pressure that our healthcare system is coming under due to those predominantly that are not vaccinated entering into it. And I believe we're about 80% of our cases are in unvaccinated individuals, and 70 to 80% of our hospitalizations also are in those that are not vaccinated, which make up about 30% of our population here in the province, those that are eligible. So as those discussions came through the last 7 to 10, maybe 14 days, we ensured that we, first of all, were able to come to some decisions around how to support that healthcare system and what public health measures would prove to be effective in the weeks and months ahead, and then ensure that what we are going to announce can actually be put into action and be operational in our communities. And so we came to some of those conclusions late last week. Quickly announced those on Friday, which was the first stage of this announcement, which was predominantly focused on supporting the healthcare capacity by moving around the human resources that we have. We started down the road of some public health orders coming in on Friday. The self-isolation order was brought back, for instance. And then today you're seeing some very significant public health orders come in, most of them to encourage the uptake of vaccines here in the province, as per your original question, but also the interim masking order that will help some of the spread immediately.
But, I'm sorry, I'm not clear if you answered the question. You didn't do this 6 days ago. Alberta did this yesterday, and now you're doing it. So are you following Alberta?
No, we started on Friday, actually. If you look back, as I said, that's why I brought you through the discussions that we've had for the last, 7 to 10, maybe 14 days, actually, that culminated in us beginning our announcements on Friday, and have seen us now put some of the other operational pieces in place that we're announcing here today.
And one follow-up, please.
Sure.
Perhaps this may be to Mr. Livingstone. Last week you talked a little bit about modeling and seeing 400 to 500 cases per day, which we're now seeing. At least one doctor has publicly stated that we could be seeing cases 800 to 1,000 per day. Can someone please answer whether that is likely to be the case?
Maybe I'd start on that, Scott, with respect to, and I don't know who this particular physician is, but there's a role for our medical community too, as well in the days ahead. And Dr. Shahab had mentioned some of the misinformation that is available, and the very high potential that of the 30% of people in this province that are eligible that have chosen not to get vaccinated have availed themselves and have been listening to some of the misinformation that is out there. And I would ask our medical community, not just our physicians, but there's nurse practitioners and nurses as well, to use the expertise that they have to explain why vaccines are safe, why vaccines are effective. Our medical community and the individuals therein have a role to play in ensuring that people understand fully how safe and how effective these vaccines are. The numbers play that out when I say about 80% of our cases are in unvaccinated individual. To me, that makes sense. Well, the numbers play out when I say 70 to 80% of our hospitalizations are people that have chosen not to be vaccinated. Those, I would hope, would be enough to cause some people pause to rethink their decision if they are not yet vaccinated. But I would ask our medical community to communicate and to take part in that conversation on a daily basis wherever they may find themselves. Scott, do you have something to add to that?
I do, Premier, and I think Dr. Shahab has something to add as well. So, Laura, just with respect to the projected cases, and I'll go back to some of the things I've already mentioned about planning. So certainly, with respect to if we just look back at our 10-day growth and apply that 10 days forward, we're looking at an estimate on the low end of 600 cases a day. So if, and to your, there's lots of nuances to your question. So that's based on no other actions, no increase in immunization, no public health measures or controls in the system. What could happen with cases? So if nothing was put in place, absolutely, in October, we certainly could hit peaks in the numbers that you have talked about. But it's what happens between now and then, knowing what we know with respect to this rapid growth. The one thing that is, and I know Dr. Shahab has touched on this more than once, is the difference between this phase of the pandemic with Delta cases, the aggressive nature of and how quickly it's coming. The curve is going up much faster than it has at any time during the pandemic. Over the last 30 days, we're seeing literally over a 480% increase in cases, 300% increases in hospitalizations. So certainly those numbers are not out of the realm of possibility, but that's in a world where, based on what we're seeing today, without other controls in place, without seeing more people being immunized, yes, that's what's on the table.
And I would say there's efforts. Dr. Shahab, did you have something to add to that?
Yeah, I just wanted to maybe make a comment on, pandemic, endemic, hyper-endemic. What does this mean for us as a society and a country and as global citizens? So no health, if Saskatchewan was a country of 480,000 people, 500,000 people, mostly young, who are unvaccinated and with no measures, no health system would be able to manage the load. And that is what Saskatchewan is right now. It's a country with open borders, with maybe 400,000, 500,000 people, if you include children under 12, unvaccinated, with a population pyramid that may have been in some lower income countries, with no controls. And no health system can sustain case numbers and hospitalization. So that's why measures are necessary, but vaccination is necessary. Many parts of the world, we have to remember, still have to see reasonable amounts of vaccines, and they have paid for this by widespread infections, inability to afford lockdowns because of loss of livelihoods, lack of social supports, lack of universally funded health systems, so inequities at every level. And then we have societies such as in Saskatchewan, like I said, high human development index, high literacy, with vaccines to vaccinate everyone by July. And we can blame governments, we can sit back and give our lazy commentary, but the reality is 30% have chosen not to get vaccinated. And so this will result in ongoing pressures on the health system and delayed surgeries. This will result in ongoing measures like today or even tighter and loosening till we get out of this, hyper-endemic periods of high transmission while we're in the global pandemic. And I would say all of this would have been unnecessary if we had stepped forward and achieved a high vaccination rate, which, while Saskatchewan is higher than many countries and Canada is higher than many countries, one wonders why, with vaccine widely available, a highly literate population, as we claim to be, would not take up that offer. So I think, it is a time of introspection. It's not a time of division, but introspection, assisting people who, due to cognitive bias or who are so deep into misinformation, need some assistance to come out of that and get vaccinated. Otherwise, this cycle of high rates, high hospitalizations could continue again and again. We may need to tighten again, even further, and then as soon as we loosen, we'll see a peak, and until that population who is unvaccinated becomes small enough for the health system to bear these hyper-endemic peaks. So I just wanted to clarify that and really give us pause to introspect instead of, pointing fingers. Thank you.
I maybe just add a little bit to that on, the case numbers. And as we know today, the most effective tool we have in driving those case numbers down, driving our hospitalizations down, is increased vaccination rates. And Dr. Shahab had mentioned earlier some of the pockets that we have and that we're paying attention to with respect to where those vaccination rates might not be as high as we hope they would be. Healthy people, for example, may not feel the urge or the necessity to go out and get vaccinated. Young people, and you'll see a lot of the proof of vaccination policies that we have in place today for large events, for restaurants, for bars, things of that nature, will address, the universities are helpful in this case, it will address some of the maybe, whether it's hesitancy or they just haven't gotten around to going out and getting their vaccine because they don't feel that it's a priority for them ultimately in their life. If employers follow the lead of the government of Saskatchewan with many of our youth, that will also help address some of the vaccination rates we have in our youth. Dr. Shahab also mentioned the rural and northern areas that where we do have some pockets of lower vaccination rates. In Regina, we're at a 74% vaccination rate. In Saskatoon, we're at a 71% vaccination rate. When you go into our regions in the north, we have much lower vaccination rates there. In the far northwest, we're at 46%. In the far north central, 38%. In the far northeast, 50%. Far lower vaccination rates than we have in our larger urban centers. That's despite allocating 14% of all of the vaccines we received to make them available in our communities. That's despite in a number of communities going door to door with vaccines and offering them to families. Our health minister, the question of our health minister was on the phone this morning, and it has been a number of times with our Minister of Government Relations, engaging our northern leaders on what more can we do to increase the uptake in some of our northern communities ultimately. And you've seen over the course of the past year, we've had to step in with public health measures. We're doing that again. I think of some of the most severe public health measures was when we actually had separated the north and had blockades up restricting who could travel in and out of the north. And we most certainly don't want to get to those types of levels or those types of decisions ultimately in the future. But we need to work together to push our vaccination rates up across the province in all communities, not just in our two major urban centers. And we are, offering to work with our northern leaders or others in, on methods on just how we can do that, and in other demographics across the province as well. I use that as an example. But we do need to work together, and I believe we can in this province to push our vaccination rates along.
We'll take our next question from Bill.
Saskatchewan is adding COVID. Can you hear me?
Yeah.
Saskatchewan is adding COVID-19 cases at the fastest rate in the country, faster than even Alberta. And yet, I think even you didn't know, and you probably watched what Alberta did yesterday, that their restrictions there's far more restrictions there, gathering limit restrictions, venues capacity restrictions, far more than you're doing here. Why do you think these will be effective, and what's the threshold for more measures like this?
Well, I'll speak very briefly as to the comparisons. Dr. Shahab, I'll let you speak to the effectiveness of the measures that we've discussed and introduced here, not only today, but associated with the measures that were previously introduced on Friday. And, that's one comparison, Saskatchewan and Alberta. You can compare to a number of states south of the border. I believe Saskatchewan has a higher vaccination rate than most, if not all of the United States, all 50 states, maybe very close if we're not higher than all of them. And we're seeing a mishmash of various rates, higher rates in some states than what we're seeing on a per capita base here in Saskatchewan, with much lower restrictions that have been put in place. What we are doing here is we're not comparing what's happening in Saskatchewan to other jurisdictions. Yes, we watch other jurisdictions for the effectiveness of the tools ultimately that they are using. But I'll go back to the fact that we're trying to make the very best decisions that we can, given the information that we have at this point in time, to preserve the healthcare capacity that we want to offer here in Saskatchewan. Dr. Shahab, do you have anything to add to that?
Yeah, thank you very much. And I just want to say that, we know what our strengths are in Saskatchewan. We have wide open spaces. We have, for the most part, great indoor spaces, whether it's a workplace, it's a leisure center, although we do have challenges with household crowding in some urban areas in the north. So when we look at our advantages and our challenges, obviously getting vaccinated is critical, but till such time, and as long as we have a high transmission rate like we have now, maintaining that physical distance, wearing masks in indoor public places, those are all things we have to look at. And, in terms of metrics, I mentioned the metrics that as a province we are now more than 30 cases per 100,000, more than 11% test positivity, as well as pressures on hospitalization. So those are metrics that we'll be following. But there's also a momentum to infection, which is larger in larger urban centers. But in smaller geographies and northern communities have shown that again and again, you have a cluster, you have an outbreak, everyone kind of course corrects, wears a mask, stays home for a couple of weeks, the outbreak settles down. And we've seen some communities with high vaccination rates haven't had outbreaks. We've seen some communities with 20-30% vaccination rate, an outbreak in a community of 1,000 or 100 people, 2 or 3 people hospitalized, 1 or 2 deaths, very tragic. But then suddenly the vaccination rate goes up to 80-90%, problem goes away. And the plea really is by northern leaders is why should communities wait for an outbreak to happen? Vaccines are accessible. They can be made accessible again through connecting with our SHA partners. And this really is the time before winter sets in to reach a high vaccination rate and take advantage of all the wide open spaces we have outdoors and how to be safe indoors, which right now means wearing a mask, practicing physical distancing, and staying home from any event or gathering if you're sick and getting tested. Thank you.
So is the message today that this is the limit? So is the message today that this is the limit that you're willing to go to, or are other measures still on the table?
We're not discussing other measures today. But in saying that, you know, if you take my statement of we take the information that we have at any point in time, we look at that with the hospital capacity that we're able to provide. We most certainly feel that we have made some significant announcements and taken some significant steps on both sides internally in making significant adjustments to preserve and to support that hospital capacity from an operational perspective. Many of those were last Friday. Now externally, and that is hospital staff ultimately supporting one another and being reallocated throughout the system, bringing in some third-party procurement of testing and such to support that as well. Today is more about how the rest of us in this province can, from the external perspective, support our healthcare system here in Saskatchewan. We're putting forward a number of measures, proof of vaccination, proof of negative tests, a masking policy, to really bend those numbers down. All of these decisions are made with the information that we have today. I'm not going to speak as to hypotheticals about what may occur in the future. We feel that we have made what are likely the most significant, or taken the most significant measures ever taken in the history of the province. Another province next to us has gone a little bit further. Other provinces maybe have not come quite this far, but we are making the decisions with the best information we have today. We're making them in the best interest of the people of this province. We're making them, and I'll be honest, reluctantly, but we're making them to ensure that we can preserve that hospital capacity and care for people that come through the front door.
We'll take our final question from Jason.
Premier, a number of people I talked to today say it's belated, but applaud a number of the measures being taken today. One they have questions about is the proof of vaccine or vaccine mandates for employee groups or for events or things like that. Why allow testing as an alternative if vaccination is your goal?
So as I said a number of times, people will have the option. Whether or not they get vaccinated. There will not be mandated vaccinations from the government of Saskatchewan. I've been clear with respect to that. That being said, I've also said that if you choose not to be vaccinated, how you move around in our communities will become increasingly difficult in the days ahead. And I think that's what the proof of vaccination, proof of a negative test policy really starts to weigh in on. Some of those uncomfortable events will be it is on you to procure, pay for, and find a private provider to provide you with that test. You need a healthcare provider to provide it, and the rest of the province, through the Saskatchewan Health Authority, is not going to be paying for that test. That test is you will be providing on your own through one of the private operators that operate here in the province, and you'll be paying for it as well. We'll come to a determination on how often those frequent tests will have to be made available to ensure that we are, if you are attending an event or a business and you're unvaccinated, that you are attending in a safe manner and you don't have COVID at that point in time. And so the inconvenience is more than just the test. There will be a cost associated with this as well.
Just a final detail on that. spoke of these rapid home tests that you're going to be greatly expanding. Is that, just to be clear, that won't be proof of a test for anything?
No, a proof of a test will have to be administered by a healthcare provider, and those details will be provided in the very near future. The self-test, rapid tests that we are going to make available are really for, and other provinces have done this, really for people to access, for example, if they're in contact with someone that had COVID. They're asked to self-monitor. They may want to go out and get a test, and rather than going and waiting in line at one of our PCR testing sites, you'd be able to go out, and we envision possibly walking into a pharmacy saying, could I get a rapid self-test, bring that home, test yourself. If it's a negative, they're fairly definite on the negative. If it's a positive, you would ultimately then be asked to go, or should go get an actual PCR test to confirm that. What those tests availability, the goal there is to provide convenience for Saskatchewan families, but also to alleviate some of the pressures that we're seeing on our PCR testing sites as well, given the higher numbers and the higher points of contact that we have. Consequently, and I would just say for families, those tests are already available today through your schools. Families could request one of those tests through the schools. We literally have hundreds of thousands of them available in our 700 plus schools across the province. And so if a family did want to get their hands on a rapid self-at-home test, they'd be able to request one from their schools today.
Sure, thank you.
Yeah, sure.
Sorry, just final detail. Is the other aspect of this, how will you prevent, or how will you ensure that they pay for it themselves through a private provider?
Yeah.
What's to prevent, say, several thousand Rough Rider fans day before, 2 days before the game, going through an SHA testing site
yeah, well, they'll be asked as to why they're there, and I suppose they could lie, and they'll have to deal with St. Peter at some point later in time on whether or not they're going to do that. We're working through precisely how we'd be able to screen that. The fact of the matter is we are relying, like we have throughout this pandemic as well, to some degree, on the compliance and the honesty of Saskatchewan people. It has bode well for us to date, and we will be relying on that as we move through the next number of months as well, relying on Saskatchewan people to ultimately, do the right thing. This is not this global pandemic, and how we are managing our way through as a society in this province is nothing like we have ever faced before. I've often said this is our generational challenge. Over the course of the last 20 months, we have seen the very best of people, often, more often than not. We have also seen the very worst of some people. And I would just ask Saskatchewan people that as we look ahead to the next number of months and ultimately finding our way through this, that we all focus and concentrate and really make sure we're putting our best forward. We're a stronger province when we all do that, and we do that together, and ultimately, our success is going to be far greater when we are all putting our best forward, and I've seen that more often than not here in the province in the last 20 months, and I hope to see it over the course of the next number of months. Thank you.
That concludes the availability. Thank you for joining us.
Thank you, Dr. Shahab and Scott.